there is overwhelming evidence that in individuals without cardiovascular disease, and particularly without heart failure, increasing physical activity and reducing sedentary behavior, so reducing the amount of time that we spend in sedentary behavior, is associated with a lower risk for cardiovascular disease, improved survival, and overall improved cardiovascular health. We did this study because despite this evidence in patients with heart failure, in individuals without heart failure, there was really not very much in the literature about the role of sedentary time and physical activity in patients with an established diagnosis of heart failure. My name is Salvatore Carbone, and I'm an assistant professor in the Department of Kinesiology and Health Sciences in the College of Humanities and Sciences at Virginia Commonwealth University, VCU, in Richmond, Virginia. And I'm delighted to be here today to talk about an upcoming articles that will be published in the Mayo Clinic Proceedings entitled Effects of Replacing Sedentary Time with Physical Activity on Mortality Among Patients with Heart Failure, National Health and Nutrition Examination Survey Follow-up Study, that I published together with my co-authors, Dr. Young-Dok Kim, who's an assistant professor in the Department of Kinesiology and Health Sciences, Dr. Justin Canada, who's an assistant professor in the Division of Cardiology, Polyart Center at VCU, Jonathan Kenyon and Haley Billingsley, which are both PhD students in our Department of Kinesiology and Health Sciences, Dr. Ross Arena, who's a professor at University of Illinois at Chicago, and Dr. Carl Chiplavy, who's a professor at the John Hochner Heart and Vascular Institute in Louisiana. And I'm delighted to be here to talk about the results of this article. And particularly, we investigated the effect of sedentary time and physical activity in patients with established heart failure. And we are really interested in this population because despite improvements in therapies over the last few years in these patients, mortality and risk for hospitalization in this population remains extremely high. And so we looked at data from the NHANES. Particularly, we look at objectively assessed physical activity and sedentary time using an accelerometer, which I believe is one of the strengths of our work, since most of the prior work used survey and self-reported physical activity as well as sedentary time. And we looked at the effect of substituting sedentary time with any level really of physical activity. And we divided that in light physical activity as well as moderate to vigorous physical activity. So what did we find? First of all, from a descriptive standpoint, we found that on average, patients with heart failure spend approximately 70% of waking hours per day in sedentary time, which equal to approximately 9 hours. This was followed by light physical activity for approximately 29% of their waking hours, almost 4 hours per day. And then only 1% of the time waking hours in this population was spent in moderate to vigorous physical activity, which is by itself already a very interesting finding that really highlights the very high time spent in sedentary time, as well as very limited time spent in physical activity, both light and in particular moderate. Not only that, when we actually looked at isotemporal substitution, so what happens if a patient, for instance, would switch 10 minutes of their sedentary time with physical activity, we found that there was a dramatic benefit by just changing their sedentary time with 10 minutes of light physical activity. And specifically, just 10 minutes from switching 10 minutes from sedentary time to light physical activity, which equals to a slow walk of approximately 2 miles per hour, would be associated with a 7% relative risk reduction for both cardiovascular mortality or all-cause mortality. And the higher was the replacing time with sedentary time to light physical activity, the greater were the benefit. Specifically, when the replacing time was 30 minutes, there was about an 11% lower risk for all-cause mortality. When the replacing time was 60 minutes, so an hour per day, replacing sedentary time to light physical activity, there was a 36% relative risk reduction for all-cause mortality and almost 50% relative risk reduction when 90 minutes of sedentary time were replaced with light physical activity. We did see a trend, however, did not reach statistical significance when sedentary time was substituted with moderate to vigorous physical activity. likely due to the fact that very few patients actually achieved this amount of physical activity, and the study was likely underpowered to really look at moderate to vigorous physical activity effect. Nevertheless, this fact were actually replicated with a very similar odds-r ratio, also in terms of death from cardiovascular causes. So what are the implications of our findings? Specifically, as I mentioned earlier, patients with heart failure, they have a very high risk for mortality and a risk for hospitalization. And so being able to potentially reduce their risk by just replacing sedentary time with as little as 10 minutes per day with light physical activity, which, as I mentioned, is about a 2 miles per hour walk. So it's a safe intervention in this population. It's really it's really important. And this, of course, would not be on it would be an intervention on top of approved guideline-directed medical therapy. And we believe that this requires also future randomized control trial, really targeting sedentary time and substituting sedentary time with physical activity, from light to moderate to vigorous physical activity. Very important implication for our patients. From a research standpoint, as I mentioned, there is definitely the need for a future prospective randomized control trial, but this is an initial evidence that hopefully will inform future guidelines and future recommendation from the clinicians to increase physical activity as little as 10 minutes per day, and possibly even more to reduce cardiovascular as well as all-cause mortality in this population. One of the limitations of our study is that the patients had heart failure. This was a self-reported diagnosis of heart failure, as all diagnoses in the most diagnoses in the NHANES. And so we were not able to really differentiate the effects of replacing sedentary time in light physical activity in patients with heart failure with reduced ejection fraction as opposed to heart failure with preserved ejection fraction. However, this, like I mentioned, this is initial evidence, and hopefully future study will be more specific in targeting one or the other population. In summary, we show that replacing sedentary time with physical activity as low as 10 minutes per day can have dramatic benefit in the patients with a diagnosis of heart failure. With this, I would like to thank the Mayo Clinic Proceedings for publishing our article, and of course, all our co-authors that have worked hard over the last few months to design and publish this work. So thank you very much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.